Typhoid fever. It's an communicable disease. Look at this picture shows detail going on. Introduction. Typhoid fever is a bacterial infection caused by Salmonella typhi. It is a significant public health concern, particularly in areas with poor sanitation and limited access to clean water. A definition. Typhoid fever is a bacterial infection caused by Salmonella typhi, primarily transmitted through contaminated food and water. It is characterized by high fever, abdominal pain, headache, and sometimes a characteristic rash called rose spots. Without prompt treatment with antibiotics, typhoid fever can lead to severe complications. Types. There are no distinct types of typhoid fever, but it can vary in severity from mild to severe and can sometimes lead to life-threatening complications if left untreated. Causes. Typhoid fever is caused by ingesting food or water contaminated with the bacterium Salmonella typhi. This bacterium primarily spread through the facial oral route, often due to poor sanitation and hygiene practices. Risk factors. 1. Travel to endemic areas. Traveling to regions with poor sanitation increases the risk. Second, contaminated food or water. Consuming food or water contaminated with Salmonella typhi. 3. Close contact with infected individuals. Being in close contact with someone who has typhoid fever increases the risk. Complications. Intestinal perforation, a rare but serious complication where the walls of the intestines are punctured. Second, hemorrhages, internal bleeding, especially in the digestive system. 3. Organ failure. Typhoid fever can lead to failure of various organs, particularly if not treated promptly. Pathophysiology: after injection, Salmonella typhi bacteria penetrate the intestinal wall and spread to the bloodstream, cause systemic infection. They can then infect various organs, leads to the characteristic symptoms of typhoid fever. Signs and symptoms. 1. High fever. Sustained fever that can reach up to 104 degree Fahrenheit. Second, headache, often severe and persistent. 3. Abdominal pain, especially in the lower abdomen. 4. Weakness and fatigue, feeling extremely tired and lethargic. 5. Rose spots, pink spots on the chest and abdomen. 6. Constipation or diarrhea, often alternating between the two. Medical diagnosis. A diagnosis is usually based on 1. Blood culture, identifying Salmonella typhi in blood samples. 2. Stool cultures, detecting the bacteria in stool samples. 3. Serological test, detecting antibodies to Salmonella typhi in blood samples. Nursing diagnosis. 1. Risk for infection due to presence of Salmonella typhi. 2. Acute pain related to abdominal discomfort and headache. 3. Fluid value deficit due to fever and gastrointestinal symptoms. Management. Antibiotics treat typically involves antibiotics like ciprofloxacin, azithromycin, etc. 2. Fluid replacement to prevent dehydration due to fever and gastrointestinal symptoms. 3. Rest. Adequate rest is essential for recovery. 4. Nutritional support. Provide easily digestible foods and fluids. Treatment. Antibiotics are the mainstay of treatment. Supportive care, including hydration and rest, is also crucial for recovery. Psychosocial medicine. 1. Patient education and empowerment, providing comprehensive education to patients and their families about typhoid fever and empower them to take an active role in their care. Second, supportive counseling. Many patients with typhoid fever may experience fear, anxiety, or stress due to the severity of illness, potential complications, and uncertainty about recovery. Three, family and community engagement. In many cultures, family and community support play a crucial role in illness management and recovery. Engaging family members and community networks can provide additional support and resources to patients with typhoid fever. Four, addressing stigma and discrimination. Stigma and discrimination related to infectious diseases like typhoid fever can have significant psychosocial impacts on patients and their families. Five, health promotion and resilience building. Promoting positive health behaviors and resilience can enhance the psychosocial well-being of patients with typhoid fever. Prevention. 1. Vaccination. Vaccines are available for typhoid fever and are recommended for travelers to endemic areas. 2. Sanitation and hygiene. Improving sanitation and promoting good hygiene practices can help prevent the spread of typhoid fever. 3. Safe food and water. Ensure food and water safety by avoiding contaminated sources. Conclusion. Typhoid fever is a serious infectious disease caused by Salmonella typhi bacteria. Prevention through vaccination, sanitation, and hygiene practices is crucial in controlling its spread. Promote diagnosis and appropriate treatment are essential for managing the illness and preventing complications. Public health efforts aimed at improving sanitation and access to clean water are essential in reducing the burden of typhoid fever globally. Thank you. Have a wonderful day.